Okay, we're back. This is the next step in our process. Again, we're in the system as Jane Doe, hospital caseworker. We've already shown the discharge feature, and thank you for your feedback on that. Now we're gonna expose to you how we're thinking about exposing all of the cases. Again, this is linked directly to your EHR, so whatever your EHR's got that's relevant to discharge and length of stay index and 30-day readmissions, we're going to pull it right here. So there's not going to be some difference between your EHR and your DPath information. It'll all be synchronized. We're just trying to pull those features out, supplement them, and have them all in one place. EHR plus other. Okay, so cases, we've got our pre-admit cases. These are folks who have scheduled surgeries. They're not yet here. We know they're coming, and we want to be able to start our casework on the folks who are pre-admit. If they have a long-term care insurance policy, it needs to be prepared and filed. Now would be the time. If those patients are eligible for remote patient monitoring, they need to be set up on home biometric monitoring that they're eligible for. Now is the time. So I want to know from you on pre-admit all the things that can be done for a patient with a scheduled surgery. How can we make sure that we've prepared that patient as well as possible to succeed in the surgery, to not be a delayed discharge, and get them where they need to go afterwards? So feedback welcome here. We also have now my cases, Jane Doe. This is all JD, Jane Doe. These are all Jane's patients, so she can see them all in one place. She can click on them and see a summary of who they are and what their concerns are, what the risk tier is, if there's a discharge plan developed or not. It's just a close-up view of any one of her patients. Back to here. All cases, so that's every one of these different avatars, JS, JT, JD, MH, these are all different caseworkers. So Jane Doe is a potential to see everything that the hospital is managing. And if Jane Doe were also a caseworker manager, there'd be another button here for reassign. Again, that only applies to the caseworker managers, but we can also, through all cases, we can reassign them. So let's say Barbara quit, and we have to reassign her patients to other caseworkers. Reassign, click the button, and just reassign it to Kenneth and Sandra and Richard, etc. So we have the ability to reassign cases depending on your authority. Are you a manager? Are you not? It determines whether you get that reassign button. Post-admit, so we're dealing with length of stay index, patient discharge, and also 30-day readmissions. We're treating that as one care continuum, and we think that the caseworker team should be in charge of that as well, and we're going to provide great, elegant, sophisticated tools to make sure we continue to monitor the patients on regular touch points, at least 4, once a week, post-discharge, so we make sure that we don't have a black hole after we send them out the door. We know what's going on with those folks, and we will be connected electronically to the receiving sites, whether that's skilled nursing facility, LTAC, hospice, inpatient rehab, whatever. We're going to be pulling direct information from their EHR, just like we're pulling from yours right now. So our system works before the EHR, at the time that the patient's in the hospital, which is sort of an EHR environment, and then post-EHR, we're going to be connecting to wherever they're going next. So we're trying to put everything in one place. So I'm going to move on to the next feature next, but I really want your feedback. Is this a great way to manage the cohort? Is really what this comes down to.